Hello there, you're watching The Real Story. I'm Al Terzi alongside Jen Bernstein.
Thank you, Al, and good morning to everyone at home. Well, there are a lot of people, organizations not happy with the budget Governor Lamont put forth. That includes Connecticut hospitals, who say the governor is going back on a tax agreement they negotiated with Governor Malloy.
But Governor Lamont is saying the state just can't afford to deliver what was promised, and the hospitals are crying foul. Well, Bristol Hospital President and CEO Kurt Barwis is here with us this morning.
Thank you for having me. I really appreciate it.
Thanks for being here.
All right, so what's the deal? Why did you get taxed $900,000 a year anyway? What was that all about?
Yeah, it's $900 million.
Or $900 million. Sorry.
Yeah, thanks.
Put some more zeros there.
There's a lot of zeros there. So I think it's really important to kind of step back and kind of understand the broader context of the funding of Medicaid, state Medicaid for hospitals. And so in a nutshell, and these are pretty easy numbers here, $2.3 billion a year. Last year in 2018 was $2.3 billion. That's what all the services that all the hospitals provided throughout Connecticut to Medicaid recipients last year. So who pays for that, right? How does the state get that money? $1.556 billion of it comes from the federal government. So the state doesn't actually have to pay that. They get that money from the federal government. That's nearly 67% of the total cost, right? Mm-hmm. And so now, you got 67% coming from the federal government, and then the balance would be about $750 million, which would be the state's responsibility. But instead, the state taxes the hospitals $900 million. $150 million more than the actual cost of the care.
Now, why would the state do that?
Because they have a deficit, and they're taking that money to fund their budget.
But this all started years ago.
It did. It started a little over 6 years, 6 years ago, right?
And under Governor Malloy, you guys had crafted an agreement. And we're on the third year of it right now, and it was to reduce that hospital tax, correct?
Right, that's right. And that was the state and the hospitals maximized the tax to benefit the state and to actually reduce the burden to the hospitals, right? And as I said, if you take, for example, Bristol Hospital, my net tax is $2.6 million. So at the end of the day, we're a nonprofit, charitable, mission-oriented organization. We use that money to take care of access needs in the community and build programs and recruit doctors and put services in and keep our plant and stuff updated. But they take $2.6 million away from us.
In fact, let's show that graphic that you were talking about and explain this to us, if you could. So
on the top, that's the actual tax we had last year. It's a little under $14 million in round figures. And then what we get back, the supplemental payments from that tax, are just a little over $11 million for a net loss to the hospital of $2.671 million.
Well, what are you going to do now? The governor is saying, well, I can't help what you negotiated with Governor Malloy. I'm looking at the problem that's facing me right now. If he's saying this, I don't know what he's saying to you, but so people out there may be thinking the same thing. We got a big problem here. We may not be able to live up to our agreements.
So I think the important thing is to kind of think about, so what is the impact of this tax on hospitals in the state of Connecticut? So obviously we're in this really incredibly technology oriented business with really highly qualified professional individuals, and the environment is changing. I mean, it's really changing. The incidence of assault on staff, the abuse, there's physician burnout. It's all providers are getting burnout because of the regulations and the rules. So you can't not fund those things, and the pressure, the upward pressure on expenses is pretty heavy. I think we tripled our security budget over the last couple of years just to make the environment safer for people. So who pays for that, right? That's what you have to ask yourself. The question is, who's making up that difference? Well, 30% of our business is commercial. So where do we have to go to get the money? We have to go to the commercial book of business. We have to go there. So what does that mean? Who's paying? It's the working population in the state, right? It's going on to employers who have commercial plans. They're self-insured predominantly, and you see it. If you talk to people, when I talk to people in the stores, in the grocery store, what do they tell you? They can't afford it. They have a deductible that's $10,000 a year, right? And so what's happening is all of that burden is actually getting shifted onto the people of the state of Connecticut, right? Because we have to be able to provide that care. But I'll tell you another interesting point. So these numbers you see, right, the tax, but there's another burden that doesn't actually get into any of the numbers. Last week I had my anesthesia group say, I can't make it anymore without a subsidy. So hospitals actually pay for and subsidize the surgeons that cover our emergency rooms and cover our hospitals because they can't make it by the payments that they get from state Medicaid. They are so inadequate and low that they cannot, and I have to provide that care. I have to have anesthesiologists cover my patients in the OR, right? I have to have general surgeons that take care of the patients when they come through the emergency room. So I subsidize all those specialty groups to take care of the patients.
Kurt, a lot of people who might not know the inner workings of the way hospitals work would look at this and say, you have these huge organizations in Connecticut. They make a lot of money. What are they really doing with it? Are they just being greedy with it? What do you want people to know out there who are watching this?
Let me tell you, a dollar that comes to Bristol Hospital is going to be returned to the community. I mean, if you look at the access to care that we've created in our communities, I mean, we didn't have a geriatric program. We went and recruited a geriatric physician and created a whole center for the community. And so not everybody's going to be able to drive, 30 minutes or 40 minutes to get that care. And all of a sudden, overnight, you now have local access to those things. We've recruited in the last year urologists. We've recruited surgeons. I mean, cardiology. Cardiology, there's a great example. So you need community-based cardiology, right? And with the rates that the doctors were getting paid, they couldn't make it on their own. So they have to come to the hospital. So you hear about, hospitals employing all these physicians. It's out of necessity, right? So I can't operate, and the community can't operate without access to cardiologists. So they actually came into our group because they couldn't make it on their own. So that's, it's really money that's actually going back into the communities. Like I said, we're mission oriented. I mean, you have to step back and say, you're taking $2.6 million from a charitable organization. How does that make sense?
You're a nonprofit.
We are nonprofit, correct.
Who are you talking to at this point now? Who have you talking to?
You talked to the governor's
in the past
office?
week?
I have not personally met with the governor's office. I know that the Hospital Association is doing that. I work with my local delegation, and I have to tell you, I've met with the speaker and others, and they are very supportive of the deal that was struck, right? And the thing is, again, we're basically paying for and the state's portion of all the care that's provided, right? They're not paying anything for it. And now they want to even go and take more. And that's just not right. It's not sustainable, You have to be able to, I use this analogy, it's kind of funny. I remember being at the West Farms Mall and seeing they were replacing the elevators, right? And I thought to myself, why are they replacing the elevators? And then I thought about my own elevators and how old they are, right? They were in the original building. And the good news is the service people are like right around the corner.
Right.
But I have an elevator out just about every day, right? It's being serviced, right? And what does that do? I have 4 main lifts. And literally, when one's out, one is specifically for patients only, there's only 2, it creates all kinds of problems for people to get upstairs, right? I need to replace the elevators.
Right.
So we absolutely are doing the same thing that's happening to our roads. We're deferring costs significantly. We need to reinvest in these structures. If you think about it, by
I'm so sorry, but we have to go with this segment right now, but I want you to keep us updated on what's going on there, and I'm sure you guys are going to have a strong effort at the Capitol talking to the governor and lawmakers there.
Thank you so much.
Come back on before the end of the session.
We're happy to bring it to the people.
Yes.
So the people know what's going on.
Thank you.
Thank you.
All right.